Hi, it's Dr. Jamie Wong from EyeCare 2020. You're watching this video because you are getting cataract surgery. So I just wanted to go over all of the instructions in the packet that you were given. This is going to go over all of your information leading up to cataract surgery and also a few things after cataract surgery, including all the eye drops that you're going to take. So first off, here is the packet that we're going to give you. It goes over your cataract surgery, before surgery, morning of surgery, and after your surgery. So at the very top, we're going to fill out your surgery date for whichever eye, and we're also going to put a check mark by whichever hospital you're going to be having that surgery at. So a few things to go over. If you wear contact lenses, make sure you do not wear contact lenses at least 2 weeks before your preoperative appointment. Your preoperative appointment is going to be scheduled so that we can take more measurements of your eye to determine what power implant we're going to put in your eye. If you do take Flomax, which is a bladder relaxing medication, make sure you don't take that 2 weeks before your surgery date. Also, we want to make sure you have your clearance form filled out by your primary care doctor at least 4 days before the surgery. So we need to have it in the office 4 days before surgery, or else you're not cleared for surgery and we might have to postpone your surgery. The surgery center will call you the day before surgery with the time of your surgery. We usually do not know what time your surgery is going to be, and we also don't have too much control of that. So that's all the surgery center side. They will call you the day before. Make sure you have a ride to the surgery center. They need to be there for at least 2 to 3 hours, so let your ride know. All right, lastly, I'm going to go over the instructions for the day before surgery. Of course, you're going to start using those eye drops, and then don't eat anything after midnight the day before surgery. And that's going to carry on to the next morning. You're going to not eat anything. Make sure you have an empty stomach. You can take your medications if you need to. The ones that don't require a full stomach, just take the medications with some water. And do not take diabetic medication. So if you have an afternoon appointment, like after 12, for example, it's okay to have a very light breakfast. You can have some juice and some toast, but nothing heavy. And it's okay to take half of your diabetic medication in the morning if you have an afternoon appointment, okay? And make sure you wear comfortable clothes, wear comfortable shoes, don't wear any makeup. And make sure you bring a jacket because sometimes the hospital can get a little cold. So now I'll go over the eye drops that you'll need to be taking and how to take it. On the second page of your packet, you're going to have a homework sheet. So this homework sheet, it has the types of medications you're going to take as long as all these little boxes, which are check boxes that you're going to check off every time you take one of your eye drops. I know it looks complicated. I'm going to come back to it. The page after that goes over the 3 different types of eye drops you're going to get. So let's start here at the top. The first one we're going to go over, this is the antibiotic drop. The antibiotic drop comes with a tan cap, this color cap. And you're going to be using that 4 times a day. You start the day before surgery and you take it for the week of surgery. So surgery day, you're also going to take it 4 times that day and keep doing that every day for 7 days after surgery. When we say 4 times a day, we want you to do 1 drop in that eye every 4 hours or so. So some people, they like to do breakfast, lunch, dinner time, and bedtime. That helps them remember when to take it. The next eye drop is the steroid eye drop. So the steroid eye drop is going to have a pink cap. It can range from a light pink color to a hot pink color. And that is the steroid to help with inflammation after surgery. You're going to start it 3 times a day before surgery. And you're going to use it for 3 times a day, the 2 weeks after surgery, and then twice a day the 3rd week, and once a day the 4th week. So for the steroid, you're going to be tapering down on it. It's really important that we taper a steroid that you're going down in a drop each week so that you don't have a rebound inflammation. Last is the anti-inflammatory eye drop. It can come in either a gray cap or a white cap. It might come in a gray cap like this or a white. Just pay attention to the name. It can be any of these. It can be the Bromside, Prolenza, Alevro, or even Cataract. That one is once a day, and that's for the day before surgery, once a day, and then for 4 weeks, it's just 1 time a day. That one's pretty easy. And you can choose to do that at any time of day. Just be consistent with it. All right, now this is the homework sheet that goes over the eye drops. This first box up here, this goes over the instructions for the day before surgery. That's when you start taking the eye drops. So this top line here, that corresponds to the antibiotic, which is the tan cap. We put 2 names here depending on just which one you get, whether it's the brand name one or the generic one. So circle the one that you have. Now that one is 4 times a day, so 4 boxes. It might help you to put the time, so like 8 a.m., 12 p.m., 4 p.m., and 8 p.m., if that's easier to remember. And then the next one is the anti-inflammatory, and that is once a day. Last one, the steroid, also anti-inflammatory, is going to be 3 times a day, just like that. Next, we have the week of surgery. This whole row here goes over how to take the eye drops the first 7 days. So here's surgery day. You might be able to get 1 set of drops in before your surgery. Then after surgery, we usually tell you guys to take it 3 hours after you get out of surgery. Just restart taking the eye drops. So surgery day, check those off, and it's going to be the same thing all throughout that week. Week 2, we're not taking the antibiotic anymore. We're just taking the steroid down here and the anti-inflammatory. And you follow that schedule there. And we're going to go all the way down to the last week. So on the last week, you're only taking 1 drop of these 2 eye drops. And that is going to be for the last 7 days. Okay? Okay, so really important that you guys follow this homework sheet just so you don't miss any drops. I know it's hard to remember when to take which eye drop, so that should make it easier for you, okay? All right, so say you decide to do 3 of these eye drops, at 8 a.m. Then I want to make sure that you spread them out at least 5 minutes apart. So take 1 drop, wait 5 minutes, take the second, wait 5 minutes, and then take the last one. And that's just to make sure, you don't wash out the effects of the first eye drop. Okay, these are really important just to prevent any infection and also to decrease the post-operative inflammation, which everyone has. Everyone's going to have a little bit of swelling and some inflammation. But yeah, those drops are there to control it. Okay, so that covers everything with the cataract surgery process. I hope that answered any questions. This video just basically went over the entire packet here. So if you still have questions about this packet, how to take the eye drops, contact us, email, call us. And yeah, that's it. I hope you guys have a great surgery. Wishing you guys the best of luck.